Some of the changes we expect to see from implementing Hucu are a little bit more of a paper trail and accountability for who we are communicating with. I think it'll allow us to identify where our gaps are, but also allow us to celebrate our champions, our sort of post-acute care champions who are doing a really great job of communicating and really staying on top of things. I also anticipate that Hucu will be able to give us some really important data and reports on how our patients are. Right now, we're not tracking a lot of the sort of social determinants of health data that I would like us to be collecting. I want to know more about who our patients are, and I want to be able to see that visually and have it inform our processes. And I think that this will be one way that we can access some of that. The staff at Hucu are really willing to tackle some of the tough questions in post-acute care and in care transitions and in this work in general. They're willing to, hop on a call and brainstorm. How are we going to solve this complicated problem? There's a lot of issues in sort of the fabric of healthcare care coordination, like healthcare and community-based care collaborations. There's a lot of question about like who's going to pay for what and how are we going to sustain this. And Hucu staff is always willing to kind of brainstorm it and look at those and really has a hands-on sort of approach with us and really helps us to understand what's going on in the healthcare landscape, what's going on in the post-acute care landscape, how can we better serve our patients, and how can we really show this and show the data to back it up. Something that I love is always, we can work and work and work, but if we have no data to show our outcomes, if we're not able to prove our value, then, unfortunately, sometimes it's not really, it may not be regarded in the way that we need it to. So I'm really excited about Hucu being able to show us some of those outcomes and really provide a lot of that data that we may be missing right now.